It is 80% of people spike to cornflakes and milk. I think it's like poison.
Your research has shown with continuous glucose monitors that different people can have different blood glucose responses to the same food, which again, I think we're so kind of led to believe that this food is going to have this impact and this food with this macros is going to have this impact. And you've spoken before about kind of serious spikers, people who have very elevated blood glucose response to foods that maybe wouldn't have an impact on others. What is the reason behind these so-called super spikers? Is it purely gut microbiome? Are there other genetic factors at play, or ultimately do we not know? And I guess my follow-up question would be, how does this new information about how different people respond to the same foods, how's that going to help inform some of our tactics and strategies to combat metabolic disease, diabetes, other things we mentioned?
Yeah, great question. So backing up a little bit. So one of the things we discovered is that when these glucose monitors first came out, they're being used for type 1 and insulin dependent type 2 diabetics to help them control their glucose better. What we did was we took these and started putting them on so-called normal healthy people and pre-diabetics. And we discovered that many of them were spiking their glucose badly. Even normal people by fasting glucose, something called hemoglobin A1C, had their glucose levels spike pretty dramatically, as bad as diabetics. And so we think they can actually capture information that's sometimes hard to measure by traditional means like hemoglobin A1C and other things. And so they clearly have glucose dysregulation. And as you said, they spike to different foods. Now, we don't fully understand what's causing that. There's no question the microbiome is part of that. And there's one study that says that 21% of that spiking, if you will, is due to the microbiome. It's probably other factors as well, your immune system, other things. And it's one thing we're working on the research side to try and understand that precisely. So if I could measure you and your microbiome, I'd be able to say, aha, you're this kind of a spiker, you spike to bananas. And someone else, we measure them and say, aha, they're going to spike to potatoes. We're not there yet. We don't know. So right now it's all empirical. But you can get there because you just put these glucose monitors on. They measure your glucose every 5 minutes, and you can see exactly what foods spike you. And so empirically, you can basically, avoid those and eat the ones that don't. And then, as I say, there's now some AI recommendation based programs that are very personalized. January AI has, this, as I say, 32 million food database. They will go in and from 4 days of training and knowing what spikes you and what doesn't spike you, they'll give you a food recommendation. Well, you do, if this one spikes you, eat this instead, and that should not spike you. It's quite accurate, actually. And there's other behavioral modifications that you can do there as well. We'll see if the listeners know, but if you just do a brisk walk after eating, you actually suppress your spikes. One of the things we teach you in the program, which is we tell you eat your favorite food in the morning. Then next day, eat your favorite food and do a 15, 20-minute walk. And you'll see your spike is way, way lower. So I know it sounds obvious, but when you see it visually, it's pretty powerful for motivating you to, modify your behavior. And then the other thing, there's a lot of basics that people don't realize as well, which is you shouldn't eat for 3 hours before you go to bed. Also take a walk before you go to bed. These all improve your glucose control. And I think so there are, behavioral modification programs that try to get to people. I think the more we can show them this visually, the more, like you were saying, if you can show people we're tracking them, they're improving, we think that that'll be very, very powerful as a behavioral modification.
Is it also the case that there's certain foods, and you've mentioned before, kind of breakfast cereal and milk that will absolutely send everyone's blood glucose through the roof, and actually we're
Yeah,
maybe feeding ourselves and our kids probably one of the least healthy breakfasts. Have I understood that right? Really, cornflakes and milk, one of the worst things we can do to ourselves?
it is. 80% of people spike to cornflakes and milk. I think it's like poison.
But I
So
mean, your
there
last
should be warning labels on that stuff. Yeah. And I'm sure these
laughing, but
frosted.
it's clearly a massive problem, because if you're getting that level of a spike and you're saying it's poison, I mean, I don't want to put words into your mouth, but can we equate this to any other kind of negative lifestyle behavior that it's as bad as?
Well, maybe not moving around at all. So lack of exercise, people spending all day in front of their screens probably isn't good either. Yeah, no, I would agree that this is a huge problem. Now, it may be they're not spiking when they're that little, right? As kids, we don't know, although there are plenty of kids that are now getting pretty obese. And there's a good chance that, in fact, we know already some of them are spiking. So, but I worry that it's creating glucose dysregulation problems that will make them bad later. Now, we know it's true for adults. 80, like you say, 80% of people who eat cornflakes and milk will spike through the roof. And so presumably, maybe they have better glucose control still when they're kids, but it's you're pushing them down a bad path. And so I think, we should be getting people to eat, well early. And quite frankly, I think a lot of the stuff probably starts in utero from pregnant women, that they should be careful about what they eat too, because we know that's a very heavily important time for influencing the health of the unborn fetus. So, yeah.
And I've heard you say before that cornflakes and milk, it's almost as bad for your health as smoking. Was that tongue in cheek, or do you?
It was tongue in cheek, but it's got to be. Just think about it. Like 9% of the U.S. is diabetic, 33% pre-diabetic. Those are horrific numbers. And the worst part is they're getting worse. This is not getting better. It's only going to get worse. So we've got to do something to get it under control. And I like the smoking. There was a time when it was very cool to smoke, right? A lot of population smoked. And I just think, obviously, that was a very successful campaign to get rid of it. A variety of things helped make that all happen. And I think we need the same kind of campaign around, sugar and getting people to control their glucose and their eating habits.